Support for the Idaho Matters podcast is brought to you in part by University of Idaho, Idaho's only Carnegie R1 classified research university. Our Carnegie R1 designation recognizes the discoveries we make that help our forests thrive. It means we're creating more doctors and doing real research to strengthen cybersecurity for Idaho businesses, our energy sector, and every Idahoan. More at go.uidaho.edu/Idaho-is-Idaho. Hey, podcast listeners, want to stay informed without the daily email overload? Sign up for our free weekly newsletter. Every Tuesday morning, we bring you the top local stories, plus highlights from Idaho Matters and the Mountain West News Bureau, all in one easy read. Stay in the know without the clutter. Subscribe now at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Flu season is well underway, and in some parts of the country, it may already be nearing its peak. Here in Idaho, most cases have been driven by influenza A, with signs that activity may be slowing, even as RSV cases are on the rise. Now, health officials say the flu vaccine is helping to keep illness mild for a lot of people, but they are also watching closely for complications and answering questions about when treatments like antivirals can help out most. So, since it is Wednesday, that means Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about all of this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, let's begin locally. So we reached out to St. Luke's Health System to get a snapshot of what they've been seeing in terms of the flu. And so what they sent us, and you have this information too, is declining test percent positivity. So this is just St. Luke's specific, but they said last week or this week, test positivity was 14.4%. That was down from 18.5% last week. And also they've seen declining influenza A concentrations in Ada County wastewater. That's the source is the wastewater scan dashboard. So what does this tell you? And yes, it is those numbers are just specific to the St. Luke system, but what does this tell you about flu activity in our area as a whole?
Well, as we talked about last week, we were in the very high category nationally of influenza activity. And within that category of very high, which is their highest category, there's three gradations. We were at the highest of the highest. So really putting this into perspective tells me there is a good chance that we've hit our peak. We're coming down. However, I would caution people that a test positivity rate of over 14 is extremely high still. It's better than what it was, but that's very high. It means there's a lot of flu out there. And the flu activity, we still don't expect this flu season to get over until probably at least April, could be May. We got reports for some other countries that it really dragged out longer than usual. I think there are some different reasons why that may not happen here in the United States. But the point being, yes, it's good news. We've likely hit a peak, but I wouldn't want people to get complacent about it. If you haven't gotten a flu shot, this is a darn good time to get it because we're probably still going to be dealing with a lot of flu for at least a couple of months. And you're going to be at risk.
And Dr. Pate, we are hearing that vaccinated people are still getting the flu, but their illness tends to be less severe. However, unvaccinated patients are reportedly showing higher fevers and elevated heart rates with this flu season. So why does the flu hit some people so much harder than others?
Yeah, so we don't know the whole answer to that, but we do know. Let's start with kids. The kids we worry about the most are those that are under 5, and particularly those that are under 2. They likely have not seen this strain of flu before. Adults my age may have been exposed to this particular strain, not the exact strain because it's mutated, but something similar enough that our immune systems would recognize it. Young kids may not recognize it. And so one of the problems that we see sometimes in young children is their immune systems just go overboard because they see this, they know they should attack it, but the immune attack itself is so overwhelming that it can make them incredibly sick. So those children are particularly likely to get hospitalized. And those are children that you can't pick out and say, oh, if I look at Susie and Sally, I would expect Susie would be the one to get sick. You can't tell who it's going to be. So those are the kids we worry about the most. And then people my age and older, those 65 and older, are at particular risk, as well as anybody that has underlying asthma or lung disease, heart disease. We often see increased rates of heart attack and stroke, particularly in the week after flu, but it can last for as long as a month of increased risk. And then we see complications that we just can't predict who's going to get those complications, whether they're ear infections or sinus infections. But more worrisome is pneumonia, bacterial pneumonia that can occur after flu, and that can be deadly. So we have to take this seriously. And again, if you haven't been vaccinated, this would be a good time to get it.
So, Dr. Pate, I want to talk a little bit more about what you just said about pneumonia, because even though hospitalizations are currently low, I know that health officials are concerned about this post-influenza complication and the secondary pneumonia. In fact, here in the Treasure Valley, we do know of some people being hospitalized for pneumonia. So why do these complications often appear later? You said, what, up to 2 weeks? I mean, so even after, you've gotten over the flu, potentially.
Yeah. So what appears to be a part of the explanation is that when you get the viral infection, it actually changes the lining of your breathing tube and the cells in your lungs. Because if you've gotten a bad influenza infection, those cells are responding to that influenza infection. But in doing so, that can weaken the defenses and cause changes that make it much easier for bacteria that might be in your throat or nose to get down into places in your lungs that they don't normally belong. And there is particularly a very, very serious situation when that bacteria, Staphylococcus, if you happen to have that, and then that gets into the lungs, we see devastating and often lethal pneumonia from that. So it's not the flu virus itself, but the flu virus sets you up for it. And that can happen with some other viral illnesses as well. We sometimes see that with COVID and other things. But it is a worry with influenza that people can get. They seem to get better, and then all of a sudden get really sick. That if that happens to you, you need to get in touch with your doctor right away.
Okay, I want to talk next about antiviral medications for the flu because, people have heard about them, but a lot of times they don't know how they work. And I will just tell you anecdotally, when I got the flu, when I think I was like 28 years old, and I got Tamiflu, it was a game changer. So tell us what these antivirals are, who should be considering them, and who might benefit the most. And then we'll get into the timeline of it, Dr. Pate, because you have to get these antivirals within a certain time frame, and I think that can be confusing as well.
Right. So we do have antivirals. Now, you and I have discussed with your listeners for years about the antiviral for COVID, the Paxlovid. So that's in that case. Now, that doesn't work for flu. And the flu antivirals don't work for COVID. So one of the things that's pretty important is to get tested if you're sick, because right now we have a lot of flu, but we do have COVID around. We also are starting to see an uptick in RSV. So you can get tests that you can do at home from the drugstores or maybe some of the grocery stores. I haven't noticed yet, but that you can test for both COVID and flu. And that's a great idea right now. And if you test positive for flu, then even if your symptoms aren't severe yet, if you get in touch with your doctor, the sooner we get you started on antivirals, the better. And you mentioned one of them, Tamiflu. There are other ones as well. And but the general rule of thumb is we want to start them within 48 hours. But again, the sooner the better. And in fact, we can even use those antivirals in situations where somebody in the household has come down with influenza and somebody else is at high risk. We can start them on an antiviral and actually prevent them in many cases from getting sick. But the big use is in trying to protect those in those highest risk groups. So as I mentioned, children under 5, and we can give antivirals to children after they're 2 weeks old. So this could be for kids, and that group up to 5 years old is particularly vulnerable. So I would really consider it there. And then again, the older group, as I mentioned. But if you have underlying lung disease, if you have underlying heart disease, and also if you're pregnant. A lot of people do not understand the risks of influenza while you're pregnant, and they're significant. And so we can't use all of the antivirals, but we do have an antiviral that we can use for pregnant women, and that's safe for the baby. So that, again, get in touch with your doctor right away, because as we talked about before, with babies, we need to prevent protracted and bad fevers in moms because it can harm the child. So taking an antiviral can be very important in that case. But the sooner the better.
So, Dr. Pate, let's talk about timing then on these antivirals, because there's a window of time that you need to get on this, right? If you have flu symptoms.
Yeah, that's right. So think about it this way. The vaccine, the flu vaccine, and you can take an antiviral even if you got the vaccine. The vaccine is priming your immune system and saying, hey, it's like giving your immune system a wanted poster and saying, look, be on the lookout for this disease. And so the immune system can go ahead and get itself prepared and be ready to fight when you get infected. But the antiviral comes in, especially when you do get infected. What it does is it impairs the ability of the virus to replicate, to make baby viruses. And so what we do is by giving the antiviral, now you're stopping that from continuing to produce many more of the virus that are infecting more of your cells, making you sicker, making you more likely to have pneumonia and other things. And so what we see is the earlier you start that, the better. And the most opportunity for improvement is to get it within 48 hours. But I urge people, as soon as you've got symptoms, and people will often can tell something is really wrong when you get influenza. It's very different than a cold. Test. If you're positive, go ahead and get started. Don't wait for the symptoms, and you can take the antiviral medicine. It will shorten the number of days that you're sick. It will reduce the severity of your symptoms, and it will certainly reduce the risk of hospitalization or death, and it can decrease the period of time that you're shedding the virus and making other people potentially vulnerable to getting infected from you.
Okay, before we go to break, Dr. Pate, I quickly want to touch on RSV because RSV is increasing, particularly in wastewater data here in our area. So how concerned should people be about RSV right now? And again, who is most at risk?
Yeah, so RSV, this is not surprising. We see it surge every winter. I was glad we hadn't seen it surge earlier, but I knew it was coming, and here it is coming. So we have to get ready. You will remember that the people that are most at risk are those young children. They are the ones, particularly infants, those in the first year of life, they are going to be at very big risk from RSV of landing into the hospital. And so typically, that group, particularly those under two, and older individuals, again, just like we talked about for influenza, over 65, particularly over 75, they don't do as well with RSV either. And so, what we particularly worry about at this time when we're seeing this uptick in RSV is pregnant moms. This is the time. Talk to your whoever's managing your pregnancy. Talk to them about RSV if you haven't already gotten your RSV vaccination, so it can help protect that child, especially if you're due in the upcoming couple of months. Be sure to have that conversation. If you have a newborn, talk to your pediatrician, because we do have a treatment we can give the infant to help prevent them from getting RSV and landing in the hospital. And then for adults, a couple years ago, we had a new RSV vaccine approved. It's available. You can get it. You just get one so far. At some point, I imagine there will be a recommendation for another booster, but right now you just get one shot. So if you haven't gotten that in the last couple of years and you're over 65, particularly if you got a new addition to the family coming, you're going to have a new grandchild, be around very young children, work in a daycare, work in a pre-elementary, good idea to get the vaccine.
Last week, Health and Human Services Secretary Robert F. Kennedy Jr. unveiled updated federal dietary guidelines, and they're already sparking debate. Now, while the new advice continues to urge Americans to cut back on ultra-processed foods and refined carbohydrates, it also marks a shift by embracing red meat as well as full-fat dairy and a stronger emphasis on protein at every single meal. Now, some nutrition experts are welcoming the change, but others are warning it could increase cardiovascular risk for many people. So we wanted to get Dr. Pate's thoughts on this. So Dr. Pate, what stands out most to you about these new dietary guidelines compared with the previous versions?
I think it's exactly what you said that stands out to me the most. These dietary guidelines are based on decades of evolving research. And therefore, we don't usually, these come out like every 5 years, and we don't see usually anything earth shattering. We see some tweaks and minor changes, but after years and years and years of data suggesting that saturated fats increase cardiovascular risk and disease, as you mentioned, I think the most startling thing to see was this kind of recommendation and endorsement of increasing red meat in our diet, of which I know of not a single study to support that, and increasing not reduced fat dairy products, but whole fat, dairy products. I think that was very surprising. I think the other thing that was very surprising to me is people my age will remember when the food pyramid was a big thing, but that went away, I think maybe a decade ago, because it was just so inadequate, and so they changed to the plate demonstration where it showed you portions and all. That made a lot of sense. Now all of a sudden they've gone back to this pyramid and they've flipped it on its head, and it's just very confusing. And I think it's really questionable what data is this based on. And of course, it's had a cloud of controversy because while RFK Jr. criticized past efforts because of industry conflicts, the people that were involved in shaping this new guidance there were people with strong ties to the dairy and beef cattle industries. So it's a mess.
So, Dr. Pate, the other thing I want to touch on is that last week we talked about the change to the childhood vaccine schedule. And we are already hearing from pediatricians now who are saying that these guidelines are already causing confusion, and they're concerned about this. So in our last couple of minutes, give us best advice right now for parents, because they're, since they've changed this, it's this idea now of like basically consult with your pediatrician, which that's great advice. As we said, in theory, in practice, it can be difficult.
Well, yes. Here's my advice. If there was new data out to support the changes, I would wholly endorse them. There is not. And I've reviewed a lot of this data on my blog. You and I have talked about a lot of it. There's no new evidence. So what I suggest to you is do not look to the CDC and HHS for your vaccine recommendations. Talk to your pediatrician or your family doctor. And if you want to research it, go to places that have been basing their recommendations on science. Go to the American Academy of Pediatricians. Go to the Vaccine Integrity Project at CIDRAP. Go to the Vaccine Information Center at the Children's Hospital of Philadelphia. There's a lot of places where you can get really good information. There's immunize.org. There's just a lot of good places to get it. Right now, ACIP and HHS is not a good source for that. Trust your pediatrician and your family physician, whoever's providing that primary care.
Yeah, because Dr. Pate, I am a firm believer that 99.9% of parents are making decisions that they believe are in the best interest of their child. They want their children to be safe. They want their children to be healthy. And it is a matter now of, conflicting false information that is out there.
It is. And I totally agree with you. I have, unfortunately, in my career, seen a very small number of parents that did intend to hurt their children. That is extremely rare. Every parent that I know, they want to do the best for the child. They're just confused. They're getting mixed messages. And here's what I would tell you. What would break my heart is for a parent to make a decision based on wrong information that they don't know is wrong, and then something bad happens to their child. So get good information. Your pediatrician or family doctor can provide that to you. As I mentioned, some of these sites can provide that to you. Get good information. Then, when you're fully informed, if you decide not to get the vaccine, then there you go. That's your choice. Now, but don't let somebody trick you and then have something terrible happen to your child. And mark my words, we are going to see more pediatric hospitalizations and more pediatric deaths and resurgences of more infections other than the pertussis and the measles that we're already seeing. There's going to be more diseases. So get good information, make a decision for yourself.
All right. Well, as always, Dr. Pate, we so appreciate you. We've been talking to former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, Dr. Pate. Remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.
Hey, I'm Peter Pruitt from Zoo, Idaho.
And I'm Dr. Leif Tapinola with the Idaho Museum of Natural History.
Together we host The Nature of Idaho, a podcast all about how our state's amazing landscapes, wildlife, and geology shape life here in the Gem State.
Each week we dive into nature stories from across Idaho, everything from fossils to forests, and sometimes even a few fun facts you can share on your next hike.
So join us as we celebrate everything that makes wild Idaho special.
Listen to The Nature of Idaho from KISU, wherever you get your podcasts, or at KISU.org.